Okay. All right. Hi, everyone. Welcome back to the podcast. Today, I'm joined by Dr. Rachael Lovink, a naturopathic doctor based in Victoria, BC. We will be delving into all things digestion, bloating, constipation, IBS, the SIBO diet, and debunking some common protocols like food sensitivity testing and elimination diets. So we'll get into it. So thank you so much for joining me today. I'm excited to have this conversation.
Me too.
Yeah, so just for a little background for you guys, Rachel and I used to work at a clinic, a naturopathic clinic, probably close to 8 years ago now. So it's always nice to get back and connect with each other too. So
Yeah, and how much our practices both have changed since then.
yeah, I was thinking that just before we popped on too, just about how much has changed and seeing your growth and just seeing you on
Yeah,
social media and kind of how things have changed for you too. So it's kind of neat to it's a nice thing about the internet, you can stay connected with people. So
totally. Actually, we were laughing about that, how like we watch each other both on Instagram and how we hadn't talked in so long, but it feels like we've talked because we watch each other on Instagram.
yeah. Yeah, just through a screen, but it's good.
Totally.
So yeah, so I'm excited for our conversation today, especially around digestive health, because I think so many people struggle with digestion and kind of we live in a world, I think, in conflicting, overwhelming advice, especially on the internet. So I think,
Hmm.
our conversation today, kind of helping people to kind of crowd out that noise and kind of focus on the real things that are going to matter. So I'm excited to talk about that. But maybe to get started, can you share a little bit with us about kind of your background and what drew you to naturopathic medicine and specifically digestive health?
Yeah, I mean, you'll probably hear this story repeated with many naturopaths. You know, and even probably anyone who's in the health field, we usually get
Mm-hmm.
into this because of our own struggles.
Mm-hmm.
So that was kind of my journey. I struggled with digestive issues and actually mental health concerns because, as you'll probably learn in this talk today, they often coexist. But um, for probably 15 years, maybe, honestly, if I were to look back to my like earlier childhood, it was probably there a lot longer,
Mm-hmm.
and really didn't know what I was dealing with until kind of things came to a head. And I ended up at my doctor's office, not my doctor, actually, I think it was a walk-in clinic. And I was sort of prescribed an antidepressant for my GI issues. And so that was
Oh,
kind of the turning point for me that really said, well, this doesn't make sense. Like I am dealing with digestive issues. And yeah, I probably had some anxiety, but it really kicked off my exploration of can what else can I do to get my health back on track? And that was kind of actually when I looked into getting into naturopathic school. And I actually did this, like, I think it's called Clean, the book by Alejandro Younger. I
okay.
did his, like, I think it's like a 2 week or maybe it's 3 week. It's kind of like a detox cleanse, which is ironic because that's the same things I'm debunking, but the
Yeah.
principles of which he talks about in that it got me curious about another way, right? And so that's
Mhm.
what got me into naturopathic medicine. But actually, if we go forward from there, it wasn't actually until after I finished naturopathic school that my career, well, I started my career, but then a few years into my career, I really made a turn in how I was practicing.
Mhm.
And what I mean by that is I really started embracing evidence-based medicine. And, a lot of the information that sits out there on social media and even just on the internet around digestion and so many topics are they're what's the word I'm looking for? They're popular and a lot of them are not correct. And so I had fallen into a lot of those traps, even in my own naturopathic schooling. And what really turned me was when I turned into evidence-based medicine. And that journey was when my own digestive health really made a turn for the positive. So that's kind of the kind of short version. There's obviously lots of things to explore there. But yeah, it was a really big change. And I had ignored my IBS diagnosis for years. And it was actually then when I finally accepted it and really understood what it meant and really looked at the evidence-based tools that were available and why I wasn't being helped, which wasn't that my diagnosis was wrong. It's that I wasn't being offered the right kind of care. And no one had ever explained to me what IBS was. So I know we're going to talk about that, but that was really a big turning point for me.
Yeah, well, I think that's the biggest thing that I hear from clients that come in for digestive issues. It was like, and I had that kind of mentality that, doctors just anytime someone went in and had a digestive issues, it was just stamped, well, you have IBS and here's some Metamucil and a PPI and or an acid blocker and send you on your way. And then people are kind of like, okay, well, what is there anything else going on? And there's no recommendations around nutrition or supplements. And I know doctors don't really have the time to go into that anyways, but yeah, so that's an interesting connection that you made with being on a antidepressant and how it influenced your digestive health too. So kind of like a light bulb moment that sometimes we're looking at all these different things
Yeah.
and not
Yeah.
missing
And I
certain
think it
connections.
totally, and it can be a really disheartening and really discouraging experience for people who try to access care for their chronic digestive symptoms and they end up in their doctor's office and they just get handed an antidepressant or just get told, in this context, because we're talking about IBS, but this exists in all chronic GI issues that are not a disease, right? Of people who like have all the things ruled out and the doctor says, well, you don't, you're fine, just go maybe eat some more fiber, go manage your stress. Or if they're telling the patient that it's IBS, they're saying maybe go try the low FODMAP diet.
Right.
And the thing that I have learned over the last 6 years is that none of what the doctor does, for the most part, there's always going to be the one-off experiences that are just awful and it's bad bedside manners. But for the most part, it's not that what the doctor has offered you is wrong. And even in the case of antidepressants,
Mhm.
it's actually the biggest gap in care for people accessing primary care for chronic digestive issues is actually the time spent explaining and the level of care and explaining even the treatments themselves, but that people need a much more comprehensive approach to their health than just like obviously a medication or just like being told to go follow a diet.
Mhm.
So the gap is usually not in that the doctor missed something or that the doctor didn't prescribe the right thing. It's usually how that's explained. And the
Mhm.
one example I use is in IBS, for example, is that when I was offered an antidepressant, that actually wasn't the wrong treatment. And actually, when we look at the evidence around how to treat IBS, antidepressants, which we've now changed what we call them in the context of IBS, we call them neuromodulators.
Okay, yeah.
They actually do help to repair the gut brain communication, which, if you know anything about IBS, and I know we'll talk a little bit more about this today,
Yeah, I want
but
to get
IBS
into
is a,
this.
yeah, it's a
The
gut brain
missing
disorder.
connection, I think, and I think especially with digestive issues, people are always wanting like food, food, food. And
Mm-hmm.
it's like we're not looking at, yeah, the mind body connection, the
Yeah.
stress, the influence of the nervous system too. So,
Yeah. Yeah. It's a big piece, but I just wanted to highlight that piece that it's a lot of the frustration that I hear from patients who have been to primary care is he just offered me an antidepressant. And my answer is always, well, that's not necessarily wrong. It's just that you need so much more than that. And your doctor should have explained what IBS is so that you don't go down a rabbit hole looking for an alternative explanation. And this is, I
mhm.
think, a lot of what we're going to talk about today is like, people end up searching for an alternative. And that's where they end up with things like candida and SIBO and parasites and all these things, when in reality, they do have IBS and they just need a more comprehensive care plan.
So maybe we'll kind of piggyback off of that. How does somebody know, like if they're going to their doctor or even coming to you, how do you differentiate between an IBS diagnosis and something else that could be going on, like you just mentioned, like SIBO or Candida or I don't know, H. pylori or the leaky gut? Like
Sure.
where do you kind of, how do you
Well,
differentiate between
yeah,
them?
that's a great question. So, the first thing I'll answer is there's a difference between legitimate diagnoses and kind of like wellness trend ones that don't actually have a lot of legitimacy. And I would put
Mm,
Candida overgrowth into that category
okay.
because when we look at the evidence around Candida, there's not much evidence to support it in the average person. So, yes, Candida overgrowth can happen in an immunocompromised person or someone who's on immune suppressants or those types of scenarios, but that's not the people that are usually thinking they have candida. There's not a lot of evidence to support that. So that's first and foremost, and that would be what I would call one of the more like, wellness trend diagnoses that actually don't have a lot of evidence. But, when we are looking at someone who has the symptoms of IBS, so abdominal pain, which first of all, like for anyone who's listening to this, if you don't have abdominal pain and you have been told or you think you have IBS, that's actually not correct, because abdominal pain is the defining feature. And I can't tell you how many patients I have seen who come to me after their doctor has said maybe they have IBS, but actually when we look at their symptoms, they don't have abdominal pain. So first of all, there has to be abdominal pain, but then you're also probably dealing with constipation or diarrhea, and it can be a bit of both, or it can be one or the other.
Yeah.
And the role of your doctor and how we differentiate it is mostly when you're going to see your doctor, he's going to run a bunch of tests, or maybe not, depending on your symptoms, to rule other things out. And that's actually a really important step. And I think people often feel frustrated and like their doctor has just told them they don't know what it is, but they ignore the fact that their doctor likely did. And very rarely do I see someone coming to see me where they haven't had the basic test done to rule the things out. And that's actually an important step. And I think just because we don't get an answer out of it and there was nothing positive that we found, people feel like their doctor didn't do anything, when in reality, they usually ran like a CRP, which is an inflammatory marker to rule out inflammatory bowel disease. The doctors probably ran like a hematology panel to check for iron deficiency, which can indicate, obviously not by itself, but in the context of your health, maybe there's bleeding somewhere. They may run a stool sample if it's kind of in that chronic condition. So it's maybe like 6 months or less, but not longer than 6 months. They might look at like an infectious cause for it. And they'll usually look at thyroid. Depending on your symptoms, they may run H. pylori, but mostly we're just ruling things out. So that's like the biggest thing your doctor's going to do. And when we rule the things out and you don't have any like alarm symptoms, so things like blood in your stool, weight loss, what we call nocturnal diarrhea, so waking up in the middle of the night with diarrheal episodes, you're not over the age of 50, you're not having persistent diarrhea every day. So there's a set of alarm symptoms that if you don't have those, again, that's another thing that we check off to make sure. And once we have those and we have them ruled off and you have the symptoms of IBS, so the criteria we just talked about, then we can confidently diagnose you with IBS. And I think that was the question you were asking me, is like, how do we make sure it's not something more serious?
Yeah.
And then also I think the other part of the question you were asking was like, how do we know it's not something like SIBO or parasites, et cetera? That's a more nuanced answer. Parasites, usually it'd be like, we go for the most obvious first. So that's the first thing, right? Like, it's not helpful for you to go down the rabbit holes when we haven't focused on the most obvious, which in this scenario, given your symptoms, it's the most likely is IBS. Unless you've been traveling to like in some endemic countries, or you've been to like, Africa or something like that, and you got sick when you're down there, it's certainly like we'll want to rule out something like parasites. Or maybe if you had gone camping and you were drinking like the stream water and that's, your symptoms came on after that, you'll want to rule out like Giardia. But like I said, usually acute infections are acute infections. And we're talking about the chronic symptoms right here. So it's usually not like, a month ago this happened. This is like people who have been dealing with these for 6 months or longer, and infections don't usually last that long. They usually get bad, they get real bad, and then they resolve, or you get treated for them. So that I would say would be the biggest distinguishing factor. And I know we're going to talk about SIBO, so maybe I'll wait for my answer on that.
Yeah, that was kind of where I was going to lead into, because I know at some point, I think it was the last couple of years, there was a book that came out that was basically, I think, labeling IBS as SIBO. And so then there was this kind of conversation around, well, is everybody that has IBS, do they have SIBO, and should you be testing everyone for SIBO? So I guess like in regards to that, how would you, same thing, like how would you differentiate? Do you automatically go and would you do testing, or are you going off symptoms again? So, or how often do you kind of see, I guess, too, like true SIBO versus IBS diagnosis?
Yeah. So the first thing I would say is like, I want to just make sure our listeners are understanding that we're talking about people who fit the criteria for IBS, because the conversation around SIBO is a little different if you don't fit the criteria for IBS. So, for someone who doesn't have the chronic symptoms, or, for someone who doesn't have abdominal pain, that's a little bit of a different conversation. And there's a much wider range of conditions we'd want to consider. But if you fit the criteria for IBS, and it's easy to go and look up the Rome for diagnostic criteria. There's usually checklists you can look at, and I described them earlier. But if you fit the criteria for IBS, or if you've been told you have IBS, and you're wondering if you might also have SIBO, or if, I think the biggest thing right now online is that, oh, it's not IBS, it's SIBO. Here's what I would say to you. I would say that first and foremost is that so let's talk about testing. So if you have the symptoms of IBS and we're wondering whether we should test you or not, my answer would be, I wouldn't test someone right out the gate, because there's a very high percentage of people who have IBS who will also test positive for SIBO, even if they don't have SIBO. And we've studied this. So a very high false positive rate. So what that means is that people who have IBS and people who have SIBO, if we were to test them both side by side, we wouldn't be able to distinguish the two conditions from one another. So what that means is if you run a test and you have IBS, there's a very high likelihood, especially with the lactulose breath test, which is the most common one that's done, that your test will show positive even if you don't have SIBO. And that's even more so in the constipation population, because in the constipation patient, their transit is likely also slow. And so what that means is that you're going to get a much higher rise in gases, which kind of puts you, like, there's a cutoff, right, of 180 minutes, and your levels will rise a lot sooner, which will show a positive test when in fact it might not be. It might actually just be the bacteria in the large colon, which is where all of your bacteria should be, and that's where we should see the rise in gases. So
that makes sense.
So I wouldn't recommend it unless, and here's where the conversation changes. Anyone who has IBS, if you've done all of the things, so you've done the foundational, you've done the diet piece, you've worked on the nervous system regulation, you've built rhythms and routines to help support your motility and your gut-brain connection, and you've tried the medications, and you've done all of the evidence-based tools, and your symptoms are still not getting better, that's where I might consider SIBO, but not before that, because I see it over and over again in my practice where people have done 4, 5, 6 rounds of SIBO and they are still not any better.
Yeah.
And there's a lot of reasons why that could be. Ultimately what I tell them is, well, we haven't addressed the gut-brain communication. We haven't addressed the root cause. And I don't even love using that word, of IBS, because SIBO, if it's a part of IBS at all, is usually only a subset of the piece.
Yeah, I see. Those are really good points, because I think sometimes in the world right now, it's like everybody thinks like, well, you just want answers. So it's like throw all the testing at the person to figure out what it is, right? And so I get some referrals from a naturopathic clinic in Vancouver, and I would say the majority of them are for SIBO clients that are on a SIBO protocol. But I do see some missing links there too, because just what you said, many of them have this, it's been going on for a very long time, and they've even done the antibiotics and things haven't really resolved. And then they're kind of, the recommendations are the low FODMAP diet, and they have really limited, like, here's my list of foods, this is all I can eat. And so it's like, I think there's a lot to that conversation where it's like, there's like food fear that comes up. You're not addressing the whole person. It's just kind of like, well, let's just, here's the antibiotics and hopefully that clears it up. And then it doesn't. And then, so it's just kind of like almost like a bit of a hamster wheel that you kind of get stuck on.
Totally.
Get stuck on. So
And honestly, if SIBO was the magic formula to people's IBS, why would there be like, the stats tell us that people who have IBS are mostly are not getting resolution of their symptoms. So it's, I wish that it was as easy as just taking an antibiotic and you'd be better, but the reality is it's not. It's not so simple. It doesn't address the gut-brain communication piece, which is a core foundational part of IBS. And if you're not addressing that, which the antibiotics do not, you're not going to get long-term relief. You're going to get temporary improvement, and then you'll likely relapse. So I just, I say caution to people with that. I get the desire to want to test and to have some answer and something
Mm-hmm.
super tangible that you can treat. I so understand that. And I will be very, honest. I did 8 rounds of SIBO
Mm-hmm.
earlier on in my career when I was trying to resolve my chronic GI issues. And I get it. It's like you want this answer, but my own experience and the data and the evidence suggests it is that that's not going to get you the long-term relief because you have to learn to build rhythms and routines and address the gut-brain communication piece to actually get your bowels and your brain and your microbiota to work properly together.
And I wonder sometimes, like, because those are like the foundational pieces, and sometimes it's harder to implement those things. It's easier sometimes just to want the supplement or the medication
Yeah.
to fix it, right? You don't want to look at all the things, or maybe there's a bit of lack of education around certain topics too. But as far as, if somebody is struggling with their digestive health, what would be like the big things, like kind of the big rocks, not the little rocks, but like the big rocks that people should be focusing on when they're on, let's say, like a quote unquote gut healing journey? Where
So
would
we're
you
moving
start
outside
them?
the IBS population. So just in general, you're asking.
I guess between both of them. So even if you had, let's say somebody that does have IBS, what would be some of the biggest things that somebody should be working on and focusing on to feel better, get relief from their symptoms?
Yeah, I mean, I think it depends where you are in your IBS journey, but I'd say
Mm-hmm.
in general, for most people, they need to support. Um, I hate, like, I don't like the word nervous system regulation is really prominent out there. More what it's about is it's about providing time in your day and providing a sense of safety in your body. That's like the best way I would describe it because a lot of people who have IBS it's a very stress sensitive disorder. So it's
Mm-hmm.
not caused by stress, but it's very stress sensitive. So changes to routine, poor sleep, yeah, stress throughout the day, or even just like the go, go, go busybody person is not going to find a lot of traction with their IBS because it's such a stress sensitive disorder. So you have to build routines around your day that support motility and that support proper communication. So getting your body into rest and digest more. So that would be like the biggest piece is you do need to recalibrate your life and create routines in your day that support better rest and digest. So what that
Mm-hmm.
means is around your meals, that means eating at regular intervals. That means supporting proper elimination in the morning. I talk a lot about morning routines with my IBS patients, but really anyone who's constipated in particular. It's about, yeah, getting adequate sleep, about improving your relationship with food. And on that same note, I would say expanding your diet, not restricting it, because the more restrictive your diet is, the more restrictive your microbiome is, the more increased visceral hypersensitivity you have, which we haven't even talked about what that word means. But
Mm-hmm.
so working towards expansion. So that would be, it's not in an IBS, it's not about elimination. It's
Which I
actually
think,
about expansion.
which is usually what I see is the opposite, right? People
Yeah.
come in like, I need to take this and this and this and this out. Maybe what do you think about nuts and dairy and this and that?
Yeah.
And then they get overwhelmed and then they're not able to do it. And then the same thing, it just creates this kind of vicious cycle. But
Yeah.
just to the stress piece, like I see that so often as kind of like one of the biggest contributors to many things, hormonal imbalance,
Mm-hmm.
digestive
Mm-hmm.
issues, and kind of what I mentioned before, we get so fixated on like exercise and the foods that we're eating and eating this specific diet when we're not kind of looking at this whole other piece over here and recognizing like even simple things like the morning routine. I've had the same thing where
Yeah.
I'm like, you've had people that are especially with constipation, and they're
Yeah.
they wake up just before they have to run off to work, and they're running around and it's like go go go, and they're not. It's like you got to give yourself some time in the morning to, to go basically.
Have a
So
poop. Yeah.
have a poop. And then not only that too, just other, throughout the day too. Like I don't know how many women I see that are, working through their lunch breaks, or they're eating at their desk, or eating really, really quickly, or even skipping meals, and thinking that's helping, and not kind of making that connection about how, that quickly eating and standing and just kind of scarfing something down, how that influences their gut, and how they're breaking down their food too. And I always find it, I don't know if you notice this in your practice, but sometimes I'll ask people, so how's stress? And I'm like, I think it's good, but you're noticing, like, from the things that they're saying, they're a busy mom, they're waking up at 4:30 in the morning to get their workout in, and slamming coffee all morning, and working 9 to 5, and then kids stuff and sports, and it's just a lot going on. And you're like, I think it might be a little bit more stress than you actually think you are. So
yeah, and stress isn't always like I think when we usually think of stress, we think of like an emotional stressor, like we our job, or like stress at our job, or we think of like in a relationship, or we think of like money stress. But actually, stress is also inadequate sleep. It's also nutritional stress, not getting the right amount of nutrition, like under eating, or intermittent fasting, which can work against stress. Can also be that like busy body, go and never really resting. And actually, a lot of people exist in that, not thinking they're stressed because it's just what they're used to. And it's a survival tool, right? I get it. Like the busy mom who's like trying to manage a million things and has kids on the go. It's like you tell them to like slow down and stress, and they're like, they almost want to say F you. And I remember when I was in that stage too, it's like, well, I'm just trying to get by every day. So yes, stress is not just like, asking the question, are you stressed? It's like, look at your day, and when do you have time for the rest and digest? Are you creating, this is my favorite thing, is micro moments of nervous system regulation. And micro moments are like one of the best ways for the person who's just like, doesn't know how to like manage their stress. They just kind of feel like they're like firing on all cylinders, and maybe is that busy mom who has like a million things to do. But micro moments is attuning to your body in like the moment to moment. So maybe it's not every 5 minutes, but it's like let's call it once an hour, where you're noticing where you're holding stress in your body. Is it in your shoulders? Is it in your jaw? Is it in your belly? Is a big one for people with IBS. And just letting the stress go. That's a simple thing. That's it, right? Even just attuning to how you're holding stress in your body and letting it go. Like that act in and of itself will start to build more trust and regulation with your nervous system. Also paying attention, like when do you have to pee and when you have to poo, and are you holding it in or are you going? Are you paying attention to your hunger cues, or are you ignoring them? Every time you ignore your body's basic needs, you are dysregulating your nervous system. And that's a really big one. Yeah.
Especially with the hunger cues. I hope to have a conversation kind of around like diet culture too, and how that influences digestion too. But that's a good point, because I think especially from, the diet world, if somebody's, let's say, having digestive issues, but maybe they're on a weight loss journey at the same time, a lot of the times it's kind of that idea where it's like, we need to like push hunger down, like just ignore it, or fast, or drink coffee, or chew gum, or drink carbonated water to kind of ignore that. And I like what you said, it just kind of creates that distrust within the body, and kind of further pushes the body into that fight or flight mode. And what the point you brought up earlier too, just about how undernourishment, how that can influence stress and the gut especially too. So,
I mean, honestly, if someone's undernourishing, and again, especially in the constipation, that's like the first place I'll start. Like if you're not eating enough and you're not eating regularly enough, which there could be a lot of legitimate reasons why you're not. And we see this a lot in the GI population. So I do want to bring it up. It's really common for there to be disordered eating and or eating disorders in the chronic GI population. So for anyone who's been struggling with chronic bloating, chronic constipation, chronic diarrhea, it's super common because of course, the way food can cause our GI symptoms. And therefore we may develop either fear around eating, or we may start to take on habits to avoid that feeling, right? We don't like the feeling of bloating. We don't like constipation. So we think, oh, well, if I eat less, or if I don't eat as often, or if I delay eating, or if I avoid these foods, then I'm going to avoid the symptoms. And so 100% it makes sense why people do this. And it becomes a vicious cycle, right? So it's really messy to tease apart. Like, where did we start? Did we start with a disordered relationship with food and body, or did we start with the GI symptoms that then turned into and it's messy. So I just
Yeah,
want
it's
to
like
acknowledge that. Yeah,
what came first, the chicken or the egg in that
totally.
scenario. And I see that a lot in my practice too with, and I've heard that is like, again, they come in maybe just with that short list because that's their safe food, that's their safe list, and they don't want to kind of expand because they don't want to experience symptoms. And I understand that. Or the other side of it too, which you mentioned too, is I heard, well, I'm not going to, I'd rather not eat because as soon as I eat, I get that uncomfortable, like that distension, that bloating. So I'd rather not eat anything. And that
Yeah.
makes me so sad to hear that
Yeah,
when
me
that comes
too.
across. And then you just think of the ramifications of that too. If you're not getting enough nutrients, enough calories, like how are we going to repair our digestive system? How are we going to create enough stomach
Yeah.
acid to break our food down? We
Yeah.
need lots of we need nutrients and I think just with the constipation piece too, it's like you have to have enough stuff going in for things to come out at the same time too. So
Totally. Yeah. Yeah, it's often overlooked piece, and it can be a hard one to address. I have a lot of compassion for that. So there is
Mhm.
strategy that we have to use around that, and delicacy, and compassion, because it's not such a linear path forward often in these people where there's a lot of like food fear and there's a lot of restriction. It is a gentle path forward. There is
Mhm.
a path forward, but I'd say doing it on your own can probably feel pretty scary.
Yeah, and overwhelming. And like we mentioned at the beginning, like, if you go online, there's so much noise in the health and wellness industry. And so you go online, whether you're looking to lose weight or heal your gut or your hormones, it's like do the vegan diet or carnivore or fast or
Mhm.
cut out dairy and sugar and gluten. So it's like, if you're doing this on your own, it can be, I know this was my kind of experience before I studied
Yeah.
nutrition was I was like, okay, maybe I need to cut all these things out. And then I wouldn't be able to follow through on it. And then I go back and it was just kind of like a
Mhm.
teeter totter. And then I
Yeah.
would feel guilty. And I'm like, I don't know what. And then you're like, I don't know what to do. I don't know
Yeah.
what to do anymore. So, and I feel like, that's kind of part of our jobs is to kind of help people kind of block out that noise and help them to kind of differentiate advice they might hear online and kind of just
Mhm.
stick to the plan too. So,
Yeah.
right. As far as like, somebody's coming to see you and we're talking about, we'll kind of lead into like the elimination diets and taking foods out and, staying away from gluten and dairy. Is that something that you recommend when people come to see you? Like, are you like cut out gluten and dairy or are those the
Definitely
small,
not.
small rocks?
Yeah, those are small rocks and they're really individual. I would say
Mhm.
in general, no. In general, no, and I'll answer that in more full in a second. The only
Mhm.
caveat I'll put to that is that um, there is an increased amount, so an increased percentage of people who have, for example, IBS, where there's also coexisting lactose intolerance. So like dairy
Mm.
is one of those funny ones where like lactose absolutely can be a trigger, it can be acquired, or it can be genetic, or it could be because of your visceral hypersensitivity and microbiome. So, but the biggest thing I reiterate to people
Can
is,
you
yeah,
can you
go ahead.
explain what that means?
Visceral
Yeah.
hypersensitivity. Yeah, so that's essentially the best way I describe it is it's like your brain has a magnifying glass on the gut, but really it's the nerves in your gut. But that's kind of if you want to like envision it some way, it's like your brain's like this on your gut, and so
Mm.
any small changes that happen down there, pressure, gas production, motility, right? Like even just the contractions in your bowel feel like they're a 10 out of 10 when really they're just normal physiological things that are happening. So the guts of people who have IBS feel a lot more and feel it with a lot more intensity than a non-IBS person. So
Mm.
normal production of gas, normal motility will elicit a lot of discomfort and pain in people who have IBS. So that's what we call visceral hypersensitivity. It's a nerve thing. But it can be exacerbated by things like the microbiome or the intestinal barrier. So there's a lot of reasons why it exists, but yeah, essentially it's a nerve issue in people with that.
To clear that up of what that actually meant when you were saying it. So, okay.
It means, yeah, and I just want to expand on that one more point, is that it means that foods like the high FODMAP foods, which a lot of those foods, because they are fermented by bacteria in our large colon, that's a totally normal process. And as most people who follow the low FODMAP diet will know, or maybe those who don't, a lot of those foods are healthy foods. A lot of them are actually prebiotic foods, which is good. And that's what we want. We want to feed the good, healthy bacteria in our guts. In people with IBS, because there's a dysbiosis usually, so people in IBS have an altered microbiome when we compare them to control. So there's like imbalanced bacteria in their large colon, and they have visceral hypersensitivity. So when they intake those high FODMAP foods and the bacteria ferment it, sometimes there's over fermentation, which can happen, which produces increased amount of gases. But B, because they have those really sensitive nerves, they feel all of that pressure and the gas changes. And so it's not that the foods are bad. It's just that what is going on in the gut is creating an environment that just those foods are not working as well with. So you were asking me if we do an elimination diet.
Yeah.
I would say is that it really depends. Most people have done it. And,
Yes.
and it's not a long-term diet. So that's the biggest thing, right? We do it in some people. I never do it in my IBS-C people, almost never. But in the IBS-D population, we do see a more positive response usually. And we do it to identify what your unique triggers are, because you won't be reacting to all of the high FODMAP foods, but you'll be reacting to maybe some of them. Yeah. And so we do it as a short-term strategy, elimination for 4 weeks and then reintroduction. And as we reintroduce, we highlight which foods you're reacting to. But the biggest piece is that is just a temporary issue. And when we resolve the underlying dysfunctions, when we address the motility, when we improve the gut microbiota composition, when we work on nervous system regulation, most of those food intolerances go away. And so
you can start bringing them back in and not have a big symptoms from them.
Absolutely.
Sometimes what I see is there isn't a lot, like if people go to the doctor, they're like, okay, well, here's the low FODMAP diet, or a dietitian or whoever. Yeah. But there isn't really any kind of instruction afterwards. It's like, well, it's not kind of how long do I do this for? So people are kind of either doing it forever, or they can only do it for a certain period of time, and then they just start going back eating normally. So then, so it's that back and forth again too. So you really utilize it just for a short period of time, if you utilize it at all.
Yeah. And especially, like I said, going back to the conversation around someone who has a lot of, maybe they're already, like, let's say they come in to see me and they're already on quite a restrictive diet. Maybe they haven't specifically done the IBS, or maybe they have a lot of like fear on food, or maybe a poor relationship with food. I am 100% not doing any kind of elimination diet. No. Because we have to be so careful. Most people who have chronic GI issues, honestly, probably have some degree of disordered relationship with food, not their fault, but just because of the journey. And so I think we have to be really careful in our chronic GI population with how we're utilizing elimination diets. And in my experience, especially in the IBS-C or even any chronically constipated patient, the last thing they need is an elimination diet. They need support with their routines, their rhythm. They need to be talked to about the right kinds of fibers. So what are the right kinds to be eating? They need to be talking about pelvic flora function. We need to talk about supporting your nervous system. When we do all those things, we don't usually even ever have to touch food elimination. We're actually just talking about what foods we're eating more of. And as I'm sure you're aware, Mia, because you work a lot in the weight loss population, that when we tell people what they can eat and what types of foods to focus on, people are so much more successful, because we're not telling them all the foods they can't eat, but when we tell them what they can eat and what they should focus on, it actually crowds out the not so great foods anyways. So it kind of always ends up doing the same job anyways.
Yeah, I like that approach too. I'm very much like, can we look at our plate and ask, like, what else can I add here to kind of bump up the nutritional value versus, yeah, giving them a long list of things that they can't have. And especially when with people with digestive issues, they probably already have that long list of things that they've taken out or avoided or restricted. And then so
Totally.
giving another list, I think just creates more fear and more stress, perpetuating the whole issue in and of
Yeah.
itself. So
Yeah. So it's so delicate with how we address diet and the chronic gut warrior, I call them. Most people, like you said, have done all of the diet, so we're not going to do another one. If
mhm.
someone's like super new to this journey of like even looking at diet, sure, we might want to like highlight some foods that can like lactose, and maybe we're going to look at like, modifying some of the gas forming foods, maybe eating a
Mhm.
little bit less garlic and onions. Like there might be some foods we could highlight, but again, it really depends on where your starting point is with your journey.
Yeah. And it sounds like in your practice, you do that multifaceted approach where it's not just the food and about the diet, but you're looking at all those other things that you just mentioned at the same time. I did
Yeah.
want to talk about, because I know you talk about this a lot on Instagram and your social media, but about the gut brain connection and the correlation between the
Mhm.
nervous system in the gut. Can you talk a bit more about that and why we should be looking at that more and maybe some strategies to support them? I know we've talked about a few things like the morning routine and finding little moments throughout the day, but yeah, I'd love to hear more about
Yeah.
that piece.
I mean, the gut brain connection honestly is relevant for everybody, not just the IBS population. Of course, this is like very much the centerpiece of attention in IBS, but for anyone who's struggling with chronic GI symptoms, that's not like a disease, right? I'm not talking to the Crohn's and colitis people out there. I'm talking to like people who have these like bloating, constipation, diarrhea. Their doctors told them there's nothing wrong people. You have to think about your gut and your brain as one system. They are absolutely integrated. They are one system, and your nervous system is part of that. So we have the brain, we have your nervous system, we have your immune system in your gut, and we have the actual like structural integrity of the gut. But it's really all one system. So
Mhm.
the gut and the brain communicate. And so, for those who are new to this conversation, we have the vagus nerve, which connects the brain all the way down into your gut. And the nervous system, think of it as like a highway that communicates messages. The brain is talking to the gut, and the gut is talking to the brain. So that is why we see stress and why we see, but also why we see when someone has poor gut, why their mental health might not be good as well. And obviously that's multifactorial. We know that poor gut health is associated with poor quality of life, and that can obviously influence like your mental health. But literally directly, like when your gut is not in a good state, it can send chemical messengers up to the brain that can alter your brain's functioning. So it's so important to consider the whole system and not just be treating one side of it, especially in the IBS population. So that comes back to the conversation we had just around like your nervous system,
Mhm.
your how your body is perceiving safety, and whether it feels like it's under threat, whether or not there's actually a saber-tooth tiger. If you are always in that go-go busybody stress mode, your gut is going to feel it. And that can even be as subtle as like how you feel when you eat. And we see this so much in the IBS population in particular. If you are scared to eat, if you expect a food to cause a reaction, we call this the nocebo effect. We know placebo effect is real. We're using it literally as like our control in studies, right? Is like the placebo group controlled trials are how we assess whether a drug's efficacious or not. Well, a nocebo effect is the opposite of that, where when we are expecting something to be negative and we think it's, or maybe we've had a poor experience with it in the past, it can actually create a negative response. So
Mhm.
this is like the whole gut brain
Such
thing,
a good
right? Like our
point. That's
thoughts, our emotions.
I feel like that's well, somewhat of an easy, not maybe somewhat of an easy change to kind of change the mindset about receiving food and digestion, but
Yeah.
I think that's such a interesting point that you made about if we're fearful around food or scared of food
Mhm.
and how that actually kind of manifests how we break down and absorb that food and digest it.
Oh man, it's so big. It's so big. And honestly, like I would encourage anyone who's listening, if you feel like you get GI symptoms quite quickly after you eat, like within 45 minutes, it's not the food you just ate.
Mm-hmm.
It is literally your gut brain connection. It's the gastrocolic reflex. It's the stress. It's the state in which you are eating that is driving that. So I would encourage you to, next time you're sitting down to eat, I'm not saying this is an easy thing, especially if like we're so programmed in our fear of food, or I'm just, yeah, it can be a messy thing, but to just, get your body into that rest and digest, take some
Mm-hmm.
deep breaths, pay attention to what's happening, be an observer of what's happening when you're eating food. Are there thoughts coming up for you? Is your belly starting to clench, as you're eating X food that like maybe you're scared of, or maybe you think is going to cause a reaction? Just pay attention, and just being an observer in and of itself can help you to kind of reframe what's going on and actually give you a starting point to start to change that. Being an observer is a good place to start.
Would you ever recommend like someone doing like a food journal? Because I find that, just to your point around that connection, because I do find so many people who are talking about the busyness is sometimes it's just scarf food down and move on with our day and get the feeding over with sometimes. And then we kind of lose that connection of like how food's making us feel and making correlations like, okay, well, I had this and I kind of felt like that, or I noticed that, I had low energy in the afternoon, and correlating that to maybe things that transpired earlier in the day. Do you ever, like, would a food journal be a good idea? Kind of like just to record like how someone's feeling around their meals and taking note.
Yeah, I think journaling can be a really helpful tool, and especially if people are not aware, like if they're kind of like you said, just running through their day and haven't really paid a lot of attention to like how their body's feeling. Journaling can also help us to like identify key time. Like I said, the timing thing around symptoms matters a lot. So if you're getting symptoms within half an hour of eating, it's probably not that food. But
Mm-hmm.
often when I question people about this, they're like, I don't know, like maybe an hour, 2 hours, or maybe it's half hour. So knowing that helps us actually to tease out the cause of the symptoms you're getting after eating. So yeah, journaling is a beautiful way. The only population I would say, because this is kind of going against what I just said, is if someone, and again, like this conversation is not addressing everybody out there, but
Mm-hmm.
if you have a history of eating disorder,
Yeah.
or you have some like disordered eating that's maybe moving in that direction, I would just say a little bit of caution with this, because actually sometimes for people who are trying to actually like eat more and refeed, we actually use distraction techniques to move away from sensations in the body, because sometimes those sensations can be really overwhelming. So although I'm always encouraging people to be more like in their body and looking and attuning to what it actually, distraction for some people is a really helpful tool. So I just want to have a little caution in this conversation that this information
Mm-hmm.
does not apply to everybody. And I'm especially speaking to it because we know in our GI population, for anyone out there, that there's a really high rate of people who have disordered eating disorders with the chronic GI symptoms.
Yeah, that's a good point too, because even just tracking or writing things down, if you have a history of disordered eating, sometimes can be triggering
Yeah.
in and of itself, because then you go back and you're analyzing things and like, well, why did I have that? And maybe I had too much of that, or so. But I think sometimes if you kind of go into it being like taking that judgment piece out and being like, we're
Yeah.
using this is a learning tool and I'm learning more
Yeah.
about my body. And so, but yeah, I think it can be a useful tool, but those are really good points, especially around
Yeah.
disordered eating habits. So navigating
Mhm.
that can be tricky for
Yeah.
sure. Because I think, especially when you
Yeah.
talk about refeeding or eating more, you have somebody that's kind of fearful around, especially weight gain. It's kind of hard just to go and, well, you just need to eat more, right? It has to be a bit of
Mm.
a slow process too.
Yeah. Building
So
trust again with your body.
mhm, when we've been told so much through diet culture, especially how to not trust our bodies. So
Totally.
but
Yeah.
that's a whole conversation you could have around that in and of itself.
Yeah.
So,
Absolutely.
okay. So we talked about elimination diets. We talked a little bit about functional testing, and
Hmm.
what I did want to ask you about food sensitivity testing, because I get asked about this quite a lot, and I even the clinic that we worked at, I know I got some referrals. It was kind of like people would do these sensitivity tests, and it's like, Mia, like make a meal plan that kind of fits within this. And there is some stuff
Yeah.
that kind of came around that. So what are your thoughts around food sensitivity testing? Is it worth it? Not worth it? Do you utilize it?
I don't
Yeah.
utilize it. And the
No.
reason I don't is because we just don't have the evidence yet to support it. Um, Listen, if I could run a test that would tell me all the foods that my patient's going to react to, I would be right on that.
Mm.
But we're just not there with our evidence yet. It's, the IgG that we're currently testing. We don't know if that's, just from exposure or if that's actually showing us that the person is reacting to the food, and not enough solid evidence. So I do believe in the next 3 years ish that we will be there. So ask me in 3 years and my mind might be changed. But right now, the current testing that we have, it's just not there yet. And so that would be the first thing I would say is that, you're spending $500 on a test that's maybe telling you what you're reacting to. And, on the topic of disordered eating, you know, when you get a list that shows you a bunch of foods and a ton of them are highlighted in red that, oh my God, these are bad foods, like think of how a person is going to receive that. And I have seen patients who had a food sensitivity test like 8 years ago, and they're still avoiding those same foods because they think those are foods they're allergic to. So I just don't think that it's a good test to run in our chronic GI patient population. There are far better ways to support them through, figuring out dietary triggers. And the second thing, or maybe I'm on the third thing, I don't know, is that food doesn't show us anything outside of the IgG, which, I talk a lot about, is that there's so many other reasons why you could be having food reactions that have nothing to do with the immunological reaction to that food. So all of that food sensitivity testing is showing us an immunological. It's not showing us whether you have an altered gastrocolic reflex, whether you have lactose intolerance. It's not showing us whether you are experiencing a nocebo effect from the food. It's not showing us the visceral hypersensitivity response. It's not showing us, like, you know what I mean? There's so much it's not showing us. And so, you run this test, maybe you take out some of those foods and maybe you get a little bit better, but you're still experiencing symptoms. That's because it's not the whole picture. So I just think to have a person spend $500 on a test that is not even giving us the whole picture, and then B is maybe true and maybe not, I just feel like it's a really big gamble, and a waste of a person's money and time. And we need to be careful with how we're telling people about avoiding foods.
Yeah, I agree. And because that's what I would see with in clinic is, people would come with their little, their what foods they're allergic to or sensitive to, and it
Yeah.
show up in red and then the yellows and the greens, and it would be this long list of foods, and they're like, really, I'm not supposed to eat spinach? And then
Totally.
it was just complete overwhelm, and they're like, well, I don't know what to do because and then half the foods that are on there are stuff that they eat every single day in their
Yeah.
diet. So then it's like, okay, well, now I have to completely rehaul my diet. And I think, yeah, just what you
Yeah.
said is that, it's only looking at a very, very small, I think just doing that in isolation isn't really gonna give you much
No.
going off there.
And for the person out there who's done it and be like, well, I felt better when I did it. Well, yeah, but probably, I mean, a lot of the foods that those tests usually show back as positive are going to be the things like the lactose and maybe the gluten, right? Or it could be some of the nuts and seeds, which, like, fat can be a trigger for, like, IBS population.
Mhm.
So we don't think about all the other reasons why we may have gotten better. And also when we go on an elimination diet and we take foods out, we often also are changing other lifestyle habits, right? When we're on a health kick, right? People don't tend to think of, like, when they're taking out foods, like, let's say they get that food sensitivity test, but they're working with their naturopath and they're also, like, working on stress and they're working on sleeping better. Maybe, oh, they're taking some supplements, but they don't think about that. They just think, oh,
Right.
well, I did the elimination, I did the food sensitivity test and I got better. But how do you know it wasn't the better stress or the better, like, stress management? And so it's like creates this murky picture where I don't think people are really clear and understand that when we are changing one thing in our lives, and especially if we're seeing a naturopath or we're seeing someone like yourself, Mia, that, like, they're often also changing a bunch of other things.
Yeah, that's a
So
good
that would be
point.
my argument against that.
Yeah. How do you know it's just taking the food out, but it's not all the other good things that somebody's doing at the same time?
Yeah.
So,
Yeah.
good point. Okay, so maybe for, you know, somebody who is like, hey, I'm doing all the things. I've I'm sleeping better. I'm looking after my nervous system, regulating stress. My diet's pretty good, but I'm still have these underlying issues, or maybe they're bloated at the end of every day or struggling with constipation, um, loose stools, those sorts of things. What should be kind of the next steps that they take if they feel like they've worked on the foundational pieces? What's the next kind of step for somebody?
I think it depends on if you know what your diagnosis is. That's actually
Mm.
the most important thing. Like, I think a lot of people kind of maybe end up like being told they have IBS at some point, then they go on this journey of like trying to find the real answer. And maybe through that, they're doing all these things that you're talking about. Like, you know, they're working on managing their stress and they're, you know, maybe taking a bunch of foods out of their diet and they're trying to sleep better. I would, you know, so, but do you know what you're treating? Because, like, I've seen it a lot in my population where people have done all the things, but no one, I'll give you a most recent patient of mine who no one told her that she had functional constipation and dyssynergic defecation, which I know I just threw some words out that people probably don't know. It's essentially pelvic floor dysfunction with her
Mm.
functional constipation. And so she was doing all these, like, you know, doing this for a while and then doing that for a while and then doing this and then, but had never been given a plan and a step-by-step plan and timing of things, which does matter, especially with constipation. So if you feel like you've done all the things, I would say I get it. That feels really frustrating. And you've, you know, at one point you did SIBO and then at one point you took out foods and then um probably a lot of those things were what you needed, but it matters how we time them. And it matters, are we targeting the right things? Um, for example, in like if someone also has pelvic floor dysfunction with their constipation, you could be eating the best diet and you could be you know, managing your stress and you could be even using laxatives to help you, and you will not go properly because your pelvic floor muscles are not coordinating that last part of the release of your bowel movement. So what I am saying to this like chronic const or this chronic gut warrior person is like, have you had someone look at it and like look at the whole plan and time things properly? And do you know what you're treating? And I'm not talking about SIBO, right? We've already talked about how
Yeah.
that's probably a small part. So, you know, get a proper assessment and work with someone who can tell you exactly what you're dealing with, without moving into like the parasite realm and the SIBO realm.
Yeah.
And timing and persistence matters. And I would say the overarching theme of all the people I work with chronic GI issues is we have to build routines and rhythms into your life that support your gut and that support your gut brain communication and support your motility long term. Because if all you're doing is a bunch of these short fixes, you're taking foods out for a while, it doesn't work. You then try a supplement, it doesn't work. You then try a protocol, it doesn't work. That's not going to build long-term gut health. You need to build things into your life that support your gut health over time, and it needs to be consistent. Because I see people give up after, you know, 2, 3 weeks, which I get it. That feels frustrating. You're trying something, but it has to be built into a way of existing and a routines that are kind of you're taking into your as a lifestyle.
Yeah. And I think that, yeah, something that it's, I always say like easy, enjoyable, and maintainable. It's like if we're doing these
Totally.
like crazy things that it's like you can't see yourself doing it again in three months. It's like don't bother. It has to fit easily into your routine so that you keep showing up and doing it every single day.
Totally. Yeah. A lot of the chronic gut warriors, like, we don't need to fix your gut. And I think there's this idea out there on social media that you need to fix your gut. You
Mhm.
need to kill off the bacteria. You need to get rid of the parasite. You need to like take all these supplements to fix your gut. You need to take the food out. And that's just like, that's just so far from the truth. Like, you chronic gut warrior people are dealing with a lifestyle issue. And I
Mm.
know that's hard to hear. And there might be some genetics that influence that. And there might be some like past trauma. And there might be a previous GI infection that kind of created all this. But to fix it, you need to build a lifestyle that supports your gut. You don't, sorry, and I just used the word fix. That's so ironic. To
Mhm.
get your gut health back on track, to resolve your constipation, your bloating, your diarrhea, you need to build a life that supports it. And that's the harder work. And I get it. A lot of people don't want to do it. They want to do a 4 week protocol, but you've been doing this for 10 years. You've been doing this for 6 years and have you seen the results? No.
Yeah.
So start to build these things into your life that supports your motility, your gut brain communication, your microbiome. And that's when you'll actually start seeing lasting relief.
And sometimes it's the really, I always say it's the boring kind of unsexy stuff,
Totally.
right? We always want the fancy thing, the fancy protocol, and the things that's going to finally fix us and magically heal us. But it comes back, yeah, the boring stuff: going to bed at a proper time, nourishing yourself properly, setting boundaries,
Yeah.
saying no, drinking
100%.
water. So I
Yeah.
think your approach is just so refreshing to hear, because I think that's, again, especially online, there's just so much like, get this testing and do this and do that. And so it's like comes back to like you essentially can, like, gives that person kind of more control, I think, over their
Yeah.
situation, rather than looking for some kind of an external thing like, hey, this is going to finally fix. It's like that, you have to kind of turn it back and
Yeah.
like, what can you do and what's in your control that you need to kind of start being a little bit more, maybe more diligent with.
Yeah. And I think I get it. People need support and they need a plan. And it's not just as easy as like managing your stress, right? No one wants to be told
Mhm.
just go manage your stress, but there are tangible and doable ways we can integrate these things into your life. And often it's the sneaky things and it's identifying them and then building ways to structure a day, a week that supports your gut health long term. Um, yeah. So
Yeah, I love that. So I know, so if somebody wants to work with you, what does that, where can they find you? What are some of your offerings? I know you have a program, and I think I saw you kind of sneak peeking some other things that
yeah.
you're kind of offering. So maybe
I'm
share about
actually
that.
kind of changing gears a little bit. I have been treating mostly in the IBS realm, which I will still continue to treat. It's obviously very close to my heart. I'm an
Mhm.
IBS-C warrior myself, but I'm actually shifting my practice to treating more of the chronic constipation patient population. So you'll see my offerings changing a little bit, and they're kind of in transition. But I do work with anyone in BC, one-on-one care. And
Okay.
I'll be launching the gut rhythm method, which is again geared at constipation over the next month or so.
Okay.
And that is one-on-one care. That's kind of a 4 to 6 month container in which we move you through different steps. That's exactly what I talked about, building the
Yeah.
rhythm routines. And yeah, that's for the BC patient. For people who aren't in BC, I would say, there's more resources coming out. I'll be launching a constipation rhythm reset guide where they can purchase that from me. But follow me on Instagram. I mean,
Yeah.
you can get so much information from me on Instagram. I always am posting tips, tools, and I have some other free guides you can get through my website.
Yeah, you're very
Um,
active on Instagram. So I'll make sure I link your website and your social media handlings
yeah, thank
in
you.
the show notes too. So yeah, amazing. Well, there are lots of great conversations that we had and some really good points, and I learned a lot today too. So I appreciate you taking the time to chat and share your knowledge with everybody.
Yeah, I got a message and I'm trying to get it out to the world.
Yeah.
Stop with the protocols, stop with the cleanses, the parasite. Yeah. So thanks for giving me an opportunity to share that message.
Yeah, that's really good. So yeah, thanks a lot. And okay, we'll see you guys next time.